Hello there. Thank you for joining us again for yet another episode of the program Ben Talks. And on Ben Talks this week, we'll be talking to Senator Adeleke olorunnibe Mamora, the Minister of State for Health. He will be doing justice to areas that you didn't know about him: the fight against COVID-19, his political career, what he has been doing since he was born, how a medical doctor became a politician, and a few other things, and what lies ahead for him as a politician. Like I told you before now, that our guest on the program today is Senator Adeleke Mamora. For the younger generation that were not of age when you started this political and your drive in nation building, who is Senator Mamora?
Well, thank you very much, Festus. As you already said, my name is Adeleke olorunnibe Mamora. I was born over 6 decades ago now.
Wow.
So you can figure out what my age is like.
Well, you look like under 30 anyway, that's right.
I was born in Ijebu in Ogun State.
Okay.
Yeah, that's in Ijebu, Ijebu East local government area. I had my primary education in Ijebu, and of course went to the grammar school. From there, I spent a year at the School of Science in Lagos, and thereafter proceeded to the University of Ife, now Mamora University, where I studied medicine, taking the first degree in Health Sciences, Bachelor degree in Health Sciences, and proceeded to obtain my MBBS, that's Bachelor of Medicine, Bachelor of Surgery. And leaving the university in 1981, had a housemanship at the State Hospital in Belkuta, in Ogun State. Had my youth corps in Lagos. That was 82, 83. And then thereafter, I was a medical officer in a private hospital for 4 years before setting out to have my own private practice, Nimbus Medical Center. And while I was there, I was invited to Cadbury, Nigeria, PLC, where I was also medical officer of the company, Cadbury, Nigeria. In terms of my political career, I think my interest in politics started in my childhood years, because my dad, aside being, I told you, the principal of a teacher training institution then. So my dad was a leader of the action group in those days.
Okay.
Yeah.
It's getting closer home now.
And so each time there was a party meeting in my dad's compound, it was so fascinating. But one experience that I cannot forget was when Mama, I referred HID, there was a time that she came and had to campaign to the people right in the in the balcony of my dad's house. I mean that experience that sticks in my head, and I always recall it with a sense of nostalgia. I was still very small then, and so I had some interest, and thought that someday I hope to be part of this. Now, when I got to the university in 1974, naturally I participated. I did naturally because of my background. So I was very much interested in student unionism, which was more or less an abomination, as it were, for a medical student to get involved in, in student unionism. But I stood for an election and I won. The position of the Student Union Executive Council. I was a financial secretary precisely. So on leaving the university, I joined a number of groups. It was a group of young professionals, meeting. They were meeting at the Federal Palace Hotel in Lagos, just exchange ideas and issues of the day, political and what have you. So it was from that group of young professionals, doctors, engineers, pharmacists, that my interest got fired more. It was from that group that I became a member of the NRC. Before then, I had been a member of the Liberal Convention. There were a lot of political groups and tendencies. That was under the Babangida administration.
Yes.
And of course, so I was a member of the Liberal Convention. And from that, I became a member. When the Babangida administration came up with the two so-called elite to the left and to the right, NRC and SDP. So, because of my background, where I was coming from with my friend, so I became a member of the National Republican Convention, and I was a national delegate elected from Lagos, Shimolu constituency. Then I was national delegate to the first national convention of NRC here in Abuja in 1990. Yeah, and you know what happened along the line. The Abacha administration came on board, and then that was the end of that section. So that was how those parties were proscribed. And then the Salami administration came with a short transition period of nearly a year or thereabout, and then I became a foundation member of Alliance for Democracy. So it was on the platform of an Alliance for Democracy that contested election from Kuchefre Constituency 1 to the State House of Assembly in 1999. And thereafter, subsequently elected Speaker in 1999. And I was Speaker between 1999 and 2003. I was privileged and honored to have been again elected in 2003 to the Senate of the Federal Republic of Nigeria. That was in 2003, and then re-elected again in 2007 to 2011. So I had 2 terms in the Senate. And while I was in the Senate, in my first time, I was a member of the ECOWAS Parliament. And then, of course, while I was Speaker, again, I think it was in 2001, I was elected Chairman of the Conference of Speakers of the State House of Assembly. In 2018, I was appointed by President Muhammadu Buhari to serve as the MD CEO of National Inland Waterways Authority, NIWA. And then barely a year less. That was in 2019. I was also appointed Speaker. Minister of State for Health.
All this period, what happened to your love of medicine? Was it just to make daddy happy, or was it just the status for the boys then?
No, don't forget that I left school in 81, and I was in practice because even my year as house officer was part of my years of practice.
Okay.
My year as a youth corper was a part of my years of practice because I served in Lagos Akoka, precisely Federal Technical College Akoka, I served in the clinic of that institution. Yes, so I was a medical officer there. So, and then I told you that I was a medical officer in a private hospital, New Clinics Group in Lagos, that was from 83 to 87, 4 years. So I was a medical officer, and I started my own practice in 87, and then till 1999.
Okay.
Yes, you can see that from 81 to 99, I was actively in practice.
Wow.
Because it was 1999 that I really veered off fully, when I was elected into the State House of Assembly. My love for medical practice, yes, until now.
How has it been being a minister of the Federal Republic, especially in a very trying time where we're fighting COVID-19 globally, not just Nigeria?
Festus, thank you very much. Well, that's if I want to capture that, I would just say leadership in an unusual time.
Yes, definitely.
Really, yes, it's quite trying time, I must say, because we were confronted. The entire global community was confronted with a pandemic never seen in the history of mankind. And even the countries that were thought to be doing well in terms of their health care services virtually collapsed, because nobody really knew what exactly and how exactly the situation was to be managed. But so what it called for was for everyone to just be open and be innovative, and of course be also be ready to learn, and to learn fast as well. So when the pandemic, when we got hit, when the outbreak came here, we had to do what we needed to do through our agencies, especially the NCDC, the U.S. Center for Disease Control, National Primary Healthcare Development Agency, NAFDAC, everybody, NIPRID, everybody, NIMA, all this, everybody came together. And then, of course, our directorates in the ministry, all their services, hospital services, name it. Everybody had to just be on his or her toes to ensure that we work together. And I must commend Mr. President, President Mamora for setting up the presidential task force, which, defunct as it were now, because it has metamorphosed
into something else,
into presidential steering committee.
Okay.
No longer a task force. So the wisdom of Mr. President to come up with that body, which is a multi-sectoral body, comprising of so many ministries, agencies, bodies, and we all work together. So we're able to do what we needed to do in terms of establishing pillars for the response, and gradually we were gaining confidence in what we were doing, because we were seeing results. We can comparing us with what the other countries were doing. Of course, we are open to, like I told you, you have to be open in a period like that to see, what you can learn from other people's experience, particularly even from China, where the first,
in this case,
yes, it started, where the whole thing started. So having a lot of engagement online, of course, reaching out to WHO, World Health Organization, American Health Organization, WAHO, Africa, CDC, Africa regional, body, WHO. So we were reaching out, and then we were getting. And at the end of the day, guess what? We did things that some other countries that hitherto were thought to be advanced had to copy. So, to the glory of God, at least as of today, and happily enough, even the WHO credited us, Nigeria, for what we were able to achieve in terms of response activities to COVID-19 pandemic. So, I'm saying that in all this, I think we must give kudos to our President, President Mamora, for what he did and the support, because there was hardly anything we asked for that we were not giving as PTL, Presidential Task Force, ably headed, and I mean ably headed by the Boss Mustafa, who is the Secretary to the Government of the Federation. In fact, at the end of the exercise before our transition, we had to, the members of the PTA, we had to, I moved the motion that it should be conferred with Masters in Public Health. Because he did well in terms of providing the leadership, in terms of, and in learning fast. He's not a medical doctor, he's not a medical line at all, in fact, he's a lawyer. But, he did well as to be able to coordinate, because the body is essentially the coordinating body, but of course, with the primary response coming from the Ministry of Health. So, because Ministry of Health is a primary ministry.
Direct response ministry.
Yes, that is in charge of the response. But we all work together. So, it's quite a humbling experience, I must say, but which paid off in terms of working together and achieving results at the end of the day.
We are still talking to Senator Adeleke Olorunnibe Mamora, a seasoned lawmaker by all standard, and he's now the Minister of State for Health in the Federal Republic of Nigeria, and he has tried to do justice to most of the questions that we put across to him. Now, distinguished, sir, I will still call you distinguished because it was much more easier than calling you distinguished. Now, honorable. I don't know which one comes first. Is that the honorable or the distinguished?
As it pleases
me. Now, a few people still believe that the Ministry of Health were just doing trial and error, that most of the time you see them excel when there is an emergency and everybody has to mobilize resources. But yellow fever, Lassa fever, and a few other things are still a challenge in Nigeria, that if they only channel that kind of energy and strength that towards the case of Ebola was mentioned, you are not a minister then, and now COVID-19. So with the level of successes that we are recording, if only this energy is channeled into these other minor illnesses that are taking us, that we would have left this situation. How would you respond to that, sir?
I can tell you that even globally, the Nigeria's response to containing Ebola is still acclaimed globally. So that tells you that as Nigerians, we have that inherent capacity. But we only need to do more and achieve more. But in so doing, we need resources. What do I mean? We should be looking at vaccines.
Okay.
And vaccine production, it's not something you do in a jiffy. Well, again, some people will argue that we were able to do that.
Get COVID.
Yes, we were able to do that. But in terms of the local challenges, yes, the Lassa fever, Ebola, I believe that it's not as if we are folding our arms. I can tell you that our scientists, we have eminent scientists in country who are working. They're still working, and I'm sure that in not too distant future, we will see the fruits of the labor of this people. So we're not folding our arms. We are doing what we need to do with limited resources available. But there is no way that you won't need resources, precisely financial resources, to get some of these things done, and for you to achieve results.
Thank you very much. Now, in the course of fighting COVID, your personal experience now, what were the lows and the highs for you? Were there period you felt like quitting? Were there period you were asking yourself, if only I remain in my clinic, I will not be here?
Let me assure you that at no time did I feel like quitting. And you know the popular saying, the quitters don't win,
Yes.
and the winners don't quit. At no time did I ever feel like quitting. No. Yeah, it's quite, it's a lot of stress, no doubt about that. But then, again, I tell people that if you fear the heat, you have no business being in the kitchen. So you must be. It's a privilege for me to serve my country in whatever capacity that it has pleased God and the benevolence of Mr. President to appoint me into. So I never thought that way at all. Rather, one all along feels encouraged by the results you are getting. So yes, it could be challenging. There's no doubt about it. It was really challenging because you are dealing with COVID, and then you are hearing that Lassa fever is knocking your door, knocking at your door. You know, in some locations, or that you are battling with some debts. You are battling with some debts that you are yet to determine the cause, or again you are also battling with some outbreak of maybe cholera somewhere, or outbreak of yellow fever somewhere in the midst of a pandemic. But you just have to do what you need to do. So like I said, the joy you have at the end of the day is the ability to overcome. It's a challenge, and that's why you are there. So that's why you are there. If you cannot stand the heat, get out of the place. That's what it means. And then of course again you are having, doctors strike.
Okay, that one is another one.
So you are battling with so many things at the same time. And for me, at the end of the day, the joy is the grace to overcome and still move on.
Who is Senator Mamora outside the hustling and bustling of governance and politics?
Well, maybe that question should have gone to my wife, because it's my wife that will determine who's the one, right?
But at least from your own experience, you can tell us.
But I know what I can tell you is that by nature I have a calm disposition.
Okay.
In terms of, so I don't get easily shaking. And then of course I must thank God for the wife I have, also a graduate of the University of People, We are blessed with 3 children, a son and then twin daughters.
Wow.
So, and to the glory of God, I'm a granddad right today.
Wow! Congratulations.
So that's by way of my family, and of course,
yeah.
I was born into Baptist church, or we were born into Baptist denomination, I would say, and we have remained Baptist in our family. And the glory of God too. Son is doing very well. My daughters are doing very well.
Very well.
So that's the way it is.
Okay, does Senator Mamora sometimes smell the roses along the road outside this hustling and bustling? Because sometimes in governance you find it difficult to unwind, you find it difficult to rest. Do you rest? Do you enjoy nature? Do you play any of this game, golf or whatever?
Well, I don't play golf. I don't play golf. I play chess.
Wow.
Chess has been right from my secondary school days, and it still remains my my, in fact, I tell you that the chess set I bought way back in 1971 is still with me.
Wow.
That is to tell you how much
You cherish it.
I cherish it. It's still with me, And so when I have the time, I relax, I play chess. Then of course, I love to watch football. I don't have any special team. I just love to watch good football.
Okay.
That's all. So, whoever, although of course I have people that
A few that you are sympathetic towards.
Well, I have the people that I like, the soccer greats. Then of course I sing.
Wow.
Don't ask me to sing.
I would.
But I sing. It may interest you that I was a chorister for so many years.
Wow.
Yes. Then of course, if chance permits, time permits, yes, I love to party. But and their party.
Yeah.
Yes, and Lagos now, we go for show.
They go for sure. It's a good thing.
So those things are there.
You used to unwind.
Yes.
God giving you life. What does the future hold? What does the future looks like for Senator Adeleke?
I'm sure you don't want me to play the Nostradamus.
No, you
The
won't.
man who saw tomorrow. I don't have the gift. I don't have the gift of clairvoyance.
we just plan ahead and allow God to dispose.
I don't have the gift of clairvoyance as to be able to tell you what happens to Senator Mamora tomorrow. But all I know is that God is not yet done with me.
Wow.
Yes, and I know that I am still willing and ready to serve this country. In what capacity it will be, I cannot and I may not be able to say right now. All I just pray for is life and good health. And once you have those two, then all other things shall be added unto you.
If you have been following us, it's been Ben Talks, and the talk for today has been wonderful. I hope you enjoyed this episode of Ben Talks. Until we come your way again with another explosive edition of Ben Talks, remain a global citizen, and wherever you are as a Nigerian, make us proud. I always say that because you are an ambassador and everyone is looking up to you to represent Nigeria well. Until I come your way again, I am Festus Ejiroge Nefifen, and I've been your anchor person. Stay good.